One of the issues that's probably the biggest one today is MolDx. And if you're not familiar with MolDx, you're probably happy about that, and you probably will be eventually as well, unfortunately. So MolDx oversees about half the country, more than half the country. 28 states fall underneath their jurisdiction now. And usually Palmetto GBA down in the Southeast is kind of leading with policy there. And if you are in a MolDx area and you've tried to run any PCR panels, you're probably familiar with the need to apply for Z codes. And we're going to talk about that a little bit. It's been a big challenge. We have not seen Z codes get issued, right? So we haven't seen no MolDx Z codes issued for any UTI PCR panels across the country. Nationally, there's been a lot of groups trying. There's been a lot of publications submitted. There's been a lot of denials, a lot of iterations, and continued denial. So that has prevented our industry from really getting paid for what most people, including the leadership at MolDx, believes is better science. PCR testing is better science than culture. But there needs to be a good data case in order to unlock that and receive a Z code. And as an industry, we've yet to meet the standard that they're looking for in a study to prove that. And so, just as a little bit of context, most say for UTI, you can do a culture for probably about $9 as a reimbursement on that. PCR panels cost a lot more. So it's fairly reasonable for them to want to see really strong clinical utility before they start paying for that. And clinical utility needs to show that using that different diagnostic test results in better outcomes, different treatment, and needs to be demonstrated with data. And so I think that we do finally have a really solid plan for doing this. And I know many groups have looked into it. What MolDx wants is a study that demonstrates clinical utility and the improved healthcare outcomes. This has been a real challenge for laboratories because most of you guys, as independent labs at least, receive a sample in the door, test that sample, report out a result back to a patient or practitioner, and that's the last you see of it. And you don't know what happened 3 months later. Did they get hospitalized 60 days later? Whatever it is. It's really difficult to show the impact of that. And so we looked at doing some prospective studies and maybe forming a coalition to do that. Very challenging still to enroll a full clinical study, but we have a alternative option that we've come up with that we think is going to be the playbook for demonstrating clinical utility to MolDx. We had a solid meeting with them that got a lot of green flags on this, right? And so we want to talk about that a little bit more. We are looking for labs that are interested in working with us. I was originally trying to maybe form a big coalition to tackle this together. We're thinking now maybe less chefs in the kitchen might be the way to go, but we do want to make this available to the industry on the other side of it regardless. But we do need to prove that proof of concept with that first Z code being issued for, say, maybe we'll pick UTI PCR panel is what's looking most common. But we have a data set that does demonstrate clinical outcomes, hospitalization, readmissions, all of that in a very compelling way, and is showing about a 350% increase in hospitalizations and negative healthcare outcomes amongst patients that were treated with culture over using PCR. So we've shared that information with some MolDx leadership. It looks compelling. We need to do a little bit more work. It's not super cheap to get it done. And so if you're interested in collaborating with us on that, I think we will share more detail in a smaller setting. 600 people is a little bit big to kind of collaborate in terms of a strategy session. And so we're going to try to get that to a smaller group and maybe pick one or two labs that are well positioned to use as that proof of concept with this new strategy to unlock that Z code issues.